During the 7th Westnile Region Joint Health Sector Review Mission co-hosted by Arua and Yumbe Regional Referral Hospitals from 11 to 12 September 2024 in Yumbe District, over 170 stakeholders such as health officers, technical personnel from various districts, political leaders, partners, cultural leaders, academia, media fraternity, private entities, developmental partners, among others, stand up to express their concerns on the performance of Westnile Region health sector, more so what can be done to enhance the sector. Dr. Andema Alex, Hospital Director, Arua Regional Referral Hospital, laments on some of the challenges in key areas that still continues to affect health sector in the region.
We have very few staff. If you take the regional hospitals combined, Yumbe and Arua, their staffing is at 18%, which is very low. And most districts also have low staffing. We need to discuss this and see if we can get solutions to this. Infrastructure is another thing, another problem which we need to address, including equipment. For instance, in Arua, the orthopedic unit is very poorly equipped, and yet we have very many orthopedic cases, some of which end up being referred. There's also the issue of coordination of medical emergency services, which we need to see how best we can handle it.
Honorable Feta Geoffrey, Chairman Westnile Parliamentary Caucus, said the issue of infrastructure, staff housing, and equipment should be looked upon.
The issue of infrastructure, staff housing is very key. Arua Regional Hospital, there is a very beautiful structure there. But about, I think, between 500 to 1 billion shillings is needed to complete that facility. Now, we need a regional voice to amplify, to justify to the powers that be, that this beautiful infrastructure, when it is incomplete, it is no work done. But if you inject there 1 billion shillings, you finish it, you accommodate 10 doctors there. Issues of equipment. You train a doctor very well, he knows his work, but because he doesn't have equipment to do his work, he becomes redundant.
Dr. S.B. Kampa, a representative from Ministry of Health Department of Planning, similarly encourages the stakeholders to address the problems.
We acknowledge that there are challenges. One of the biggest is that neonatal conditions are now the leading cause of death in the country, and we need tangible measures to ensure that we address the problem and not only speak about it. The country is committed to ending the newborn death, preventable newborn death by 2030. So if we are to end, we have to have interventions in place that really address the issue. Similarly, we are committed to bringing the maternal mortality down to 70 per 100,000 in the next 5 years, and we are still, while we have registered improvement, we are still way off track. So it's my humble request that as we prepare for Zombo, we do put together interventions that will help us address these challenges.
Meanwhile, Honorable Dr. George Didi Doka, Member of Parliament of Bon Constituents and Chairman Committee on Health in Parliament, appeals to the Ministry to see that all the issues that have been discussed should appear in the budget of next financial year.
There are a number of issues and concerns that have been discussed and reflected in our action matrix that have resource implications. Without ensuring that these are captured in our ministerial policy statement, especially the policy statement of the Ministry of Health, and the votes under the Ministry of Health will not attract resources. So we appeal to the Ministry of Health to see to it that many of these issues that have been raised that have budgetary implications should appear in the budget framework papers, the ministerial policy statements, and your proposals for the annual work plan and budget 2025-2026, and in the medium-term expenditure framework of your local governments, the regional entities as well.
Yeah. Haji Sulman, Resident District Commissioner Yumbe District, encourages stakeholders to work as a team for better health services.
Here we have been pointing at each other in the ministry, national medical stores, the blood bank, the cows who are not doing recruitment, and also the cow says the ministry stopped us from recruiting. But I know this conference has made us know that we have to work as a team so that we do good services to our people.
Westnile Region Joint Health Sector Review Mission is an annual engagement at the end of every financial year, basically to enhance the health sector, and the next edition shall be co-hosted by Yumbe Regional Referral Hospital and Zombo District. Oraku Benson Pastore, Westnile Television Nilecast.